He talked about the aspect of funding, which the federal government is doing its own part. But what role can state governments play, and also the private sector, especially in the aspect you have to keep training frontline health workers to build their capacity to meet, this demand of disease outbreak? Dr. Abuja, please respond.
Okay, yeah. Primary health care generally flourishes well when there is a participation and collaboration between all stakeholders. In Nigeria, we have the federal government, the state governments, and the local governments. And besides those, we also have the private sector. In providing primary health care services, it should not only be limited to the governments, whether it is at the federal level or state level or a local government level. Communities are supposed to participate. Individuals are supposed to participate. Yeah. Private sector is also supposed to participate. So it is the participation of all these partners or stakeholders that would make up the good and expected service that we call primary healthcare service. It is not only the government. And if you listen to what the Minister of State just said, efforts are being made to provide more financial resources for health. Especially, it should be noted that this year, 2025, the health budget has been dramatically increased.
Yeah.
And that is heartwarming, because for us to be able to reach those who have not been able, who are not reachable because of distance from healthcare services, or because they cannot afford them, there has to be a good budget for health generally, and for primary health care in particular. And this should not only be limited at the federal level. States are also supposed to also increase their budgets, and with the local governments now becoming autonomous financially, it is expected that they also should make more financial provisions, because they are the people that will provide the health staff that will man the healthcare centers.
Okay.